My name is Becky Stivers, and today we're going to discuss writing a nursing diagnosis, and it really is easier than it looks. A nursing diagnosis is simply a statement of what's actually going on with your patient at any given time. You've got your NANDA nursing diagnosis books so that you can pull an actual diagnosis out of that book. However, you need to make sure that it pertains to what's going on with your client. Make sure that you do not use a medical diagnosis, as this is about nursing diagnosis. So what are the steps? How do you begin creating your nursing diagnoses? Well, the first step is going to be gathering data. You're going to take vital signs from your patient. You're going to do your physical assessment of your patient. You're going to look at their history and physical and their admission database. All information that you're going to put together and cluster on something that we're going to discuss later called the concept map. You're going to analyze and interpret this data. First, you're going to make sure that you've validated the data, that it's true, and you're going to cluster it on your concept map. This is going to enable you to identify the primary problems or needs of your client. Then you'll be able to formulate your nursing diagnosis statement based on these findings. As I've mentioned, the nursing diagnosis is derived from actual or potential problems that your patient's at risk for. They're derived from either physiological, sociocultural, developmental, and/or spiritual dimensions of your client. The focus for the nursing diagnosis is on helping the client to achieve a maximal level of wellness and their highest level of independence. It's important to differentiate between nursing diagnoses and medical diagnoses. The primary care provider comes up with the medical diagnosis, and this deals with the disease process or the medical condition that's going on with your client, and their focus is on treating that disease or curing it. Nursing diagnoses are very different because they deal with the human response to either bio, psycho, or social stressors and health problems that a nurse is licensed and competent to treat, and that's a major difference from the medical diagnosis. There are two primary purposes for nursing diagnosis. The first is for the client. It's a way for us to create individualized care for the client and make sure that we're selecting appropriate interventions to help optimize their health. It also enables us, in partnership with the client, to establish goals for optimal health. Now for nursing, it really does facilitate good communication. We're documenting what we're doing, and it provides for continuity of care. For instance, in the hospital setting, one nurse could create the plan of care. The nurse who follows could come after, read what has happened, the patient's response, and move forward with her care. And this really does provide continuity of care and great communication between providers. There are three parts to the nursing diagnosis statement. The first is the patient's need or problem. You're going to be able to determine what that problem is by looking at all the assessment data on your concept map. It's what's going on that's the problem for your patient. The related to, this is the cause or etiology of the problem. What caused it? So for example, if the patient's problem right now is pain, the related to could be a surgical incision, because that's what's causing the pain. As evidenced by, these are signs and symptoms, or evidence of the problem. If I were to ask you, how do you know your patient has pain? The as evidenced by would be what you would tell me. In other words, patient rates her pain at 8 out of 10. Or the patient has facial grimacing every time she sits up. As you can see at the bottom, the patient's needs or problem must come from your NANDA approved statement found in your NANDA book. However, the related to must be what you come up with for your patient's cause, and the as evidenced by must be what you see as the actual signs and symptoms or evidence of that problem in your particular patient. Let's take a look at a few example nursing diagnoses. As you can see, I've numbered them in order of importance for my client. Number 1 is pain related to crushed tissue, as evidenced by patient complaints of pain 7 out of 10 and facial grimacing when moving the arm. Number 2 is constipation related to low fiber intake and decreased mobility, as evidenced by no bowel movement for 3 days and abdominal distension. And number 3 is risk for injury related to generalized weakness. Please note that when you have a risk for as a nursing diagnosis, there is no as evidenced by because it's not a real problem yet. There's a risk for it. Let's take a look at how to prioritize multiple nursing diagnoses. The first is an actual problem. This is a firm diagnosis that is supported by your findings. It's validated by data that you've collected. A high risk, this is where a patient only has risk factors, but does not have any actual signs and symptoms. This is the risk for we were just talking about. Your patient is more vulnerable to develop these problems, but they don't have them yet. And then there's possible problems. These are just tentative. Additional data is needed to confirm or rule out whether you could use this. Let's take another look at the 3 parts of the nursing diagnosis. The first is the problem. It's either an actual problem or your patient has a high risk for it. These are based on the data that you've clustered on your concept map. You're going to have subjective and objective data in your boxes on your map. Remember that the problem must be in approved NANDA format. Oftentimes it will begin with modifiers such as impaired, altered, decreased, ineffective, or risk for. The second part of the nursing diagnosis is the related to. Again, this information is also found in your concept map boxes. It's part of your objective and subjective data that you've gathered. Remember, this is what caused the problem. It indicates a relationship between the problem and its etiology, how it's related to one another. This cannot be a medical diagnosis, so don't let yourself be confused with that. The related to, or what's causing it, must be modifiable by nursing interventions. For example, if pain is related to pressure from laying on the right side, it can be modified by a nursing intervention of turning the patient every 2 hours. That would relieve that pressure and help decrease the patient's pain. The nurse must be able and licensed to do something about the related to. So again, if the related to was the pressure that was causing the pain, a nurse is licensed and able to turn that patient every 2 hours. And it will be in one of 5 categories. Either the related to will be pathophysical, what's going on with the pathophysiology of the client, environmental, situational, psychological, or maturational. And finally, let's take another look at the third and final part of the nursing diagnosis. as evidenced by, or sometimes it's written manifested by, depending on the instructor and where it's taught, is also found in your concept map boxes. Again, we come back to the fact that this is part of your subjective and objective data that you've collected. This is the signs and symptoms that led to your nursing diagnosis. So, pain is our problem. Pressure was the related to from laying on that right side. And the signs and symptoms for that pain would be the patient rating their pain, 4 out of 10. Grimacing when they're on their right side. Stating that they're uncomfortable on the right side. Some other examples are short of breath while walking. Client rating their pain 7 out of 10 and grimacing. A client weight loss of 2 kilograms in the past week. The client hasn't had a bowel movement in 3 days. Or the client has an open wound on the right buttock measuring 2 by 3 by 0.5 centimeters. So you can see it's pretty simple putting together a nursing diagnosis once you've learned how each component works together.